Hello everyone, welcome back to Grow Med. So in this video we will discuss about the some important diseases which are like short and are repeatedly asked in the exam. Uh, I'll be discussing some few 7 to 8 topics, and from that all the questions we will be covering which you must know which were asked in the exam. So from this you can surely expect 3 to 4 questions coming in the upcoming December exam. Okay, so the purpose of this video is to make your revision smarter and easier, and also to help you guys with the last minute revision. Okay, so without wasting much time, let's start. The first important is the Wilson's disease, and Wilson's disease is an autosomal recessive kind of disease, and it occurs due to the mutation in the 8 ATP7B gene, and it is present on the chromosome 13. So this is a PYQ asked that mutation in Wilson's disease occurs in which of the following gene, and also chromosome 13. This have been also asked PYQ. Then autosomal recessive, this is also PYQ. Then clinical features, what all findings you can see in a patient with Wilson's disease: increased serum ceruloplasmin, then sunflower cataract, KF ring, hepatomegaly, and wing beating tremors. Wing beating tremors due to the copper deposition in the basal ganglia, causing this tremors. And for the diagnostic investigation, it is the hepatic biopsy, whereas for screening method we can use the serum ceruloplasmin. For screening of the disease, we can use the serum ceruloplasmin level, but for the diagnosis it is hepatic biopsy, because increased amount of copper will get accumulated in the liver, causing hepatomegaly. Okay, so this is the diagnostic test. So this is all about the Wilson's disease which you must know. This is the KF ring, important from the ophthalmology point of view also, because as you can see here, this ring, the brown ring, that one is the copper deposited in the cornea. And the next is the sunflower cataract. The sunflower cataract also due to the copper deposition in the lens, giving the sunflower appearance. Okay, so two important images as well as the important things. All these are important, and if at all a case is asked, then they will combine all these things in a case. Like they'll describe about the mutation, or they can describe about the features like the KF ring, then sunflower cataract, increased ceruloplasmin, and they'll ask what is the gene mutated, or they can ask the diagnosis. Okay, so be ready for any kind of the question asked. And I think by having such kind of information, you can now easily solve any question asked on the Wilson's disease. Now let's move on to the next topic, that is the Acrodermatitis enteropathica. Again, it is also an autosomal recessive kind of disease and occurs mainly due to the zinc deficiency. Okay, so like simple one liner have also been asked on this, that Acrodermatitis enteropathica occurs due to deficiency of which of the following micronutrient? It is the zinc. Or they can give the feature of this Acrodermatitis enteropathica, and they can ask the enzyme deficiency, so it will be the zinc deficiency. Now speaking about the triad, so dermatitis, dementia, and alopecia. So dermatitis means involvement of the skin, and on the skin you can see rashes described in the clinical case, and also image based question can be asked. Rashes present mainly on the genital area, then oral area. Okay, and dementia means the patient will be having this memory loss and all, and alopecia, hair fall, because zinc is an important constituent for the hair synthesis and hair growth also. Okay, so you can see these things in the question, and if these three things are present, then go with the zinc deficiency as the answer. Then the next topic, carcinoid tumor, again a repeat topic. So carcinoid tumor is a neuroendocrine tumor, and it arises from the crypt of the lubricant. So this is a PYQ. It was asked that they had described the features of the carcinoid tumor, and they had asked that a location or where it arises from. So it is a crypt of the lubricant. Then clinical features are the abdominal pain, which is the most common, and in case of gastric carcinoid, you can see bright red patchy flushing on the stomach. Okay. Metastasis is most commonly to the liver, and investigation of choice is the 5-HIIA in the urine. And if at all, if you have solved the PYQs, you might have come across this question, that investigation of choice for the carcinoid syndrome is, and it is the 5-HIAA in the urine. The other test which we can do is the SRS, sentinel receptor scintigraphy, and this one is done to look for the metastasis, that where all the tumor has metastasized, and the another is the dopa PET. So these are the investigation of choice is present for this carcinoid tumor. And if we speak about the treatment, then what we can do is the segmental resection and also end block lymphadenectomy, and we can also give chemotherapy regimen like dacarbazine, epirubicin, and 5-fluorouracil. And this 5-HIAA is also the marker for the this carcinoid tumor. And if the question is asked about the carcinoid syndrome, then it consists of various other features like wheezing, then diarrhea and sweating. Okay, so all this is the thing which you must remember from the carcinoid tumor. Then moving on to pheochromocytoma, again a repeat topic, and if at all you have solved the PYQs, then you might have come across a lot of questions regarding this pheochromocytoma. So the location is that it is a tumor of the chromaffin cells. So a PYQ was asked that a pheochromocytoma arises from which of the following cells. And the site, most common site is the adrenal gland, whereas 10% can be present even extra adrenal, and this is known as the paraganglionoma. And the most common site of the extra adrenal location is the organ of Zuckerkandel. Okay, so this was also a PYQ. Then let's look at the pathophysiology behind this pheochromocytoma. What happens is that the adrenal gland usually secretes the hormones epinephrine and the norepinephrine, or adrenaline and non-adrenaline. So these are the main two neurotransmitters released by the adrenal gland. What happens in this is that due to the tumor, there will be increased secretion of the epinephrine and the norepinephrine, and we all know that these are the sympathetic hormones, and they will increase the sympathetic activity, like causing tachycardia, then increasing the heart rate, palpitations, sweating, bronchodilation, and all those things these will be causing. So there will be increase in the autonomic symptoms like increased heart rate, palpitation, sweating, and this is the triad. So an important thing which you must know, this is the triad of the pheochromocytoma: heart rate, palpitation, and sweating. And you can also see hypertension, orthostatic hypotension in case of these patients. So what happens is the pathology behind this is that due to the increased epinephrine and the norepinephrine, its catabolism also increases, right? So you can see vanillin mandelic acid in the urine, which is the screening test for the pheochromocytoma, whereas investigation of choice will be plasma fractionated metanephrine levels. Okay, so these are the things which you must know. All the points which I've discussed here, all are the MCQs, PYQs. Chromaffin cells, a PYQ. Paraganglionoma, a PYQ. This triad, PYQ. Then catabolism, VMA, this was a PYQ. Investigation of choice, this was a PYQ. Then treatment of choice will be the surgery. Treatment of choice will be the surgery, and drug of choice, these also. Alpha blockers like phenoxybenzamine and pentolamine, because by these alpha blockers we will be blocking the activity of the adrenaline and the noradrenaline, and this is just for the symptomatic relief. These are not the definitive treatment. Definitive treatment is the surgical resection of the tumor, but for time being, to control the symptoms, we can use this alpha blocker, phentolamine and phenoxybenzamine. Drug of choice asked in integration with the pharmac also. Okay, so pheochromocytoma, a must know topic. Then moving on to myasthenia gravis. So myasthenia gravis, again a repeat topic, and surely you will be getting one question from this myasthenia gravis in every exam. So note it down, and we'll discuss all the things so that you do not miss this question if at all it comes in the exam. So it is an autoimmune disease, and by the name of the autoimmune, we come to know that the antibodies are formed against some thing. So what thing it is? The neuromuscular junction against the ACH receptors. So this is the presynaptic, this is the postsynaptic membrane, and autoimmune, this is the receptors. So ACH will be produced, but it cannot act on the receptors because of these blockers present, that is antibodies. Okay, so what happens is that there will be constantly blocking of the receptors, due to which the patient will experience muscle weakness. Okay, so this is most commonly seen in females, young females or elderly males. Okay, young females and elderly males. And clinical features are the muscle weakness, and due to muscle weakness, the patient will experience fatigue, then fluctuating ptosis because the muscles will be affected, and due to which the patient will feel ptosis, and then diplopia. So these are the main important clinical features which you must find in the question if the examiner is asking about the myasthenia gravis. Then another hint word or a piece of a cake given in the exam will be this one. Whenever you see this sentence in the exam, think or just blindly mark the answer as the myasthenia gravis, because these symptoms, they either worsen in the evening, and these symptoms improve on taking a rest, get better on taking a rest or applying ice pack. Okay, so whenever you see these things described, go with the myasthenia gravis. Then diagnosis is the penicillin test which we'll be doing, and what we do in this test is we will be using the edrophonium. So edrophonium, this drug acts for just 5 minutes, and it will help us to know that whether it is the myasthenia gravis which is causing this muscle weakness or something else. And this when we give the edrophonium, it will improve the symptoms. So let's discuss another important pharma question from here, the mechanism of action of the edrophonium. It is an enzyme inhibitor, that is an acetylcholine esterase enzyme inhibitor. This enzyme causes breakdown of the ACH, and if you block this, no, it will increase the level of the ACH. By that, the ACH can act on the receptors, and it will cause the improvement in the symptoms. Okay, so this is the mechanism of action, and I hope you have understood it, that mechanism of action, how does this work, and what is the pathology behind this myasthenia gravis. Now the other things are the drug of choice, which is the neostigmine and the pyridostigmine. Okay, so these are the drug of choice, and these were all the PYQs. So these are the points which you must know from this myasthenia gravis. Okay, then moving on to the last topic for the today's video, it will be the retinoblastoma. And if at all you guys like this video and you want more such videos, then please comment below, so that I'll understand that how many of you really want this video, and I'll be working on it and posting more such kind of videos. Okay, so also like the video, share it with your friends, and then subscribe to GrowMed if you're new to GrowMed. And you can also join with me on my Telegram channel, where you can find more amazing stuff related to the Fmge. So the topic, retinoblastoma. So retinoblastoma is the most common tumor in the children. Okay, important. Then it is also the most common cause of the intraocular calcification. So this was asked as a PYQ, as the one liner, that which of the following tumor is the most common cause of the intraocular calcification. Then the gene mutation. So RB1 gene is mutated, which is present on the 13q14, and the clinical features are the leukorrhea. Leukorrhea means, you can see here the whitish reflex here, this white thing, that is called as the leukochoria, and this is the most common symptom present. Then other symptoms are the squint, inflammation, and the uveitis. And mostly this leukochoria or white pupillary reflex, this is described in the question, which will give you a hint that the examiner is asking about the retinoblastoma. And short one question will be coming from this retinoblastoma, either on the investigation or either on the this gene mutation, or either like they can give 4 options and they can ask which is correct or which is false. Then investigation of choice is the MRI, important. Then this is also an important thing. So on histopathology examination, you can see flexner winter rosettes. So this image, let me show the image of this to you, because image based question can be asked in integration with the patho. So you can see here this patho image of the flexner winter rosettes, and in that you can see that the lumen, this is a lumen which is empty, and it is surrounded by the cells, and it is like well defined. Okay, so this feature is seen with this on the biopsy, the flexner winter rosettes. Image based question have been asked in the past year. Then for the treatment, you need to do the laser photocoagulation, and we can also use the chemotherapy drugs, that is the vincristine, etoposide, and carboplastin. You can remember it like VEC, VIC. So you can remember it like this. Then a most common location of the metastasis is the optic nerve, again a PYQ. Okay, so these were the important things which you must know related to some various diseases, and these are short like 1 2 then 3 4 or 5 questions you can expect from this whole topic. Okay, so yes, thank you so much for watching this video, and let me know if it is useful to you, and comment below about the video if you want more such sessions. Okay, thank you so much. Bye bye. and all the best for the exam.